Hello, my name's Joan Carlson, and I am an associate professor at Indiana University School of Social Work. My specialty is addiction and mental health, and today I'm going to talk to you about brief intervention. First of all, what is a brief intervention? It's a very short conversation that focuses on creating insight and awareness for behavioral change. We use motivational interviewing strategies to help facilitate our conversation with clients and patients. And what we want to focus on is, one, the tone that Julie talked about previously. Two, we want to use the previous screens that we've implementing because we want to find personal and compelling reasons for change. And once we begin to find those pieces of information, we want to build on a readiness to change, and then we actually want to help our clients make a commitment towards that change. One of the great things about SBIRT is that we have a web app that you can use at the touch of a phone, a tablet, a computer. It has a number of the screening tools on it that Julie addressed. It will score it for you with your patients and your clients, and it will actually help you begin the dialogue on what to say during a brief intervention. We look at the theoretical framework of the stages of change by Carlo Di Clemente and Jim Prohaska. The stages of change theory is the most widely used health belief model in the world. And most of you are familiar with the 5 stages of change. Pre-contemplation, where a patient is not really interested in making any type of behavioral change. A contemplative stage is where somebody's beginning to think about it. They're beginning to weigh their ambivalence back and forth. Preparation is where an individual makes a commitment. I'm going to call my doctor, I'm going to make a phone call, I want to get help, or asking for help. Action is actually going through that behavior change, and maintenance, we look at that. That begins about 6 months after someone has begun the change process and working through it. There are lots of reasons to use brief motivational interviewing. For instance, somebody comes in for hypertension, they come in for physical trauma. One of the things that we see an awful lot is uncontrolled diabetes. Brief intervention is perfect for this. And while you're doing that, you can also fit in the SBIRT brief intervention. And we do this, again, I'm going to reiterate, based on the findings of those screening questions, whether you use a short screen or a longer screen. The audit is a 10-item screening tool that gives you a pretty comprehensive look at a patient's use of alcohol. And what we do find is that so often from these screens, we are able to find personal motivational reasons for change, especially with substance use behavior. Motivational interviewing. What is it? It is a collaborative conversation that we have, and we want to build and strengthen an individual's own commitment towards a behavioral change. It's person-centered, so we're actually using a communication style and a tone that addresses the problem using ambivalence about change. And it's designed to strengthen an individual's motivation for movement towards behavior change. Now, this particular app that I showed you just a moment ago, you can have this at the touch of your fingertips, and they have a section on brief intervention, they have a section on motivational interviewing. Again, I can reiterate, it will score the actual screen. If you choose it, you can print it out, go over it with your patient, and it tells you little hints like how to begin the dialogue. Sometimes our patients, as well as we're uncomfortable talking about substance use. And Our patients, however, do expect us to give them our advice. And one of the ways you can open the conversation is by saying, I know that you came in today about your blood pressure, but there are several factors that can influence your blood pressure. Can we talk about those today? I'm building on what Julie just told you about. We're asking permission, we're using the screens, we're using a tone that's very conversational, and that will be less defensive for our patient. An example you might have is you can look and say to Mary, I see here, Mary, that you sometimes use cocaine with your friends. I'm concerned about that because it could be impacting your mood as well as your sleep. Can we talk a little bit more about that? You've got these examples right here. You tap a button on the screen and tells you exactly what to say to your client or your patient. It says, it sounds like you started out using cocaine because there were benefits. However, it sounds like there are some problems. Can you tell me more about that? One of the things we want to do is ask open-ended questions with the exception of why. We don't want to ask a client or a patient, why are you using? We also don't want to be out there preaching. We want to make this a conversation, and this is a tone, and it is led by our patient based on the responses to the screening. The basic principles of motivational interviewing are expressing empathy, develop a discrepancy. In other words, we know that an individual might have benefits, but there also might be challenges with using a particular substance or substances. We want to help them develop that discrepancy. Roll with resistance. We've all had the patient where they say, hey doc, there's no way I'm going to listen to this, I'm done. What you can do in a situation of that type is say, you know, I'm here for you. If you ever want to talk about it, if you ever want to move forward on it, I'm ready. And then last but more importantly, we want to talk about self-efficacy. We want to do SBIRT in a tone and a manner in which our patient is our partner and that we can help them build on their efficacy of making decisions to move forward and be motivated with behavior change. Here is the app that I was talking about. It is a web browsing app. You can put it on a tablet, a computer, you can print out results, and there is the address there. It was developed here by Indiana University, and I'm happy to say that Julie Vanderson, myself, and Joe Bartholomew, we were all part of the team that did develop it. Again, it is free, and it gets you started. It moves you through all the processes of the SBIRT intervention with an individual, and screening tools are available in the IU SBIRT app. And what we have here are the single questions pre-screen, the audit, which is 10 questions, and the audit has also been translated into more than 80 different languages. It was developed by the World Health Organization. It's shown great reliability and validity. The audit C, which is a short 3 questions from the audit. The craft for adolescents, so if your clientele or your patients are in adolescent medicine or you're seeing a number of teens, this is a great screener, as well as the DAS-10 for drugs. I'm going to introduce you now to Joe Bartholomew, who is going to address referral to treatment. Thank you.